In 1951, factitious disorder was mentioned for the first time, though it is not the same disorder we know it as today. Richard Asher could not understand why people would fake being sick and instead described it as a strange twist of personality and a psychological kink. In retrospect, he wasn't too far off. Ian Hacking from the early 1980s plays an important role in analyzing diagnoses in history. His work revolves around two concepts: making up people and looping effects. Making up people describes the many possible identities one could take up based on their situation or within their lives. Looping effect is whether or not people will reject an identity or learn to adapt to fit it. They may even exaggerate it, such as in the case of factitious disorder. However, this isn't entirely accurate, as Anthony Fry and Tanya Gergel's recent article shows that people with this disorder do not realize or accept that they are essentially faking this disease or illness. The article suggests that some patients are not making themselves up as a patient with factitious disorder, but are being completely taken in by the disease they are claiming to have, despite the fact that some may know they do not have this disease. Taking this into account, we can conclude that factitious disorder is more similar to a disordered identity. Yes, they are attempting to take on an identity, but it is different from making up people, as Hacking describes it more as a self-conscious identity formation. Essentially, as of right now, people with factitious disorder are seen as people who are unable to control themselves nor accept that they are faking their disease.
The proper origins and introduction of factitious disorders are widely uncertain. However, Richard Allen John Asher first observed and reported Munchausen syndrome in 1951. Often mentioned rather interchangeably, this term has been coupled with and actively labeled as a factitious disorder. To define this, factitious disorder is a condition in which a person, without a malingering motive, acts as if they have an illness by deliberately producing, feigning, or exaggerating symptoms purely to attain a patient's role. People with a factitious disorder may produce symptoms by contaminating urine samples, taking hallucinogens, and other similar extreme behaviors. Prior to the DSM-5, the DSM-4 differentiated amongst three different types: factitious disorders with combined psychological and physical signs and symptoms. This is if both psychological and physical signs and symptoms are present and neither predominates in the clinical presentation. Factitious disorders with predominantly physical signs and symptoms. This would be if physical signs and symptoms predominate in the clinical presentation. And finally, factitious disorders with predominantly psychological signs and symptoms. And this would be if psychological signs and symptoms predominate in the clinical presentation. Currently, the DSM-5 differentiates amongst two types: factitious disorder imposed on self, which is called Munchausen syndrome as previously mentioned, and factitious disorder imposed on another, Munchausen syndrome by proxy. This is defined as when an individual falsifies illness in another, whether that be a child, pet, or an older adult.
The exact cause is unknown, but researchers believe that both biological and psychological factors play a key role in its development. They may have many surgical scars and will be eager to sign up for any kind of medical test or exam. They are extremely knowledgeable of the inner workings of a hospital as well as medical terminology.
Factitious disorder is very difficult to treat for some of the same reasons that make it hard to diagnose in the first place. Very few patients with the disorder are willing to admit they have a problem. In fact, one important facet of the disorder being that patients will lie and manipulate others in order to stay in that sick role makes it unlikely that patients will be willing to honestly follow a course of treatment, even once diagnosed. There are no medications available that can directly treat the disorder. However, since factitious disorder is often comorbid with depressive or anxiety disorders, medications meant to treat those may help some sufferers. Most often, the focus of treatment for factitious disorder is on good old-fashioned talk therapy, which most often includes some form of family therapy as well, in order to instruct those close to the sufferer on how to avoid reinforcing and rewarding the patient's maladaptive behaviors. Truthfully, at this point, there is very little research on what form of psychotherapy and what general approaches are best. So treatment usually requires a great deal of creativity on the part of a therapist on how best to approach disorder. Many of the studies which exist look at whether confronting the patient as to the truth of their disorder in the therapeutic environment helps in the long term, or if a non-accusatory approach works better. At this point, it is still unclear Ultimately, treatment usually requires a long-term strategy for real recovery to occur, and unfortunately, many patients never truly get better, and suicide among those being treated with factitious disorder is very common. Thank you very much.